On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Hey there. Hey, welcome. Thank you. Hi, everybody. Have you ever had one of those days where you think that you're like going to get everything together and then you don't? Well, that's one of those days today. So I'm going to ask you to just bear with me today. Thank you so much for keeping your appointment. We're going to talk a little bit tonight. So we're just going to talk, and then I'm going to have to show you the slides a little bit later because they're not working for me tonight. Well, if this is your first time tuning in to Talking with Dr. Donna, know that I do so much better normally. But I thank you for keeping your appointment. You have an appointment every Thursday with the doctor. And our goal, our mission on Talking with Dr. Donna is to build a generational health network. That means that we look at 4 pillars of health. We look at emotional and mental health. We really focus and pay attention on that mind-body connection and the importance of making sure that when you're mentally well, that helps you to be physically well. Our second pillar is spiritual health. And that spiritual health is not religious. It's not about religion. It's really about understanding that when there's a connection, when you have a connection with people, when you have a connection with a higher power, that you're shown to have better health outcomes. Our third pillar that we look at is physical health. That's obvious, right? We have to pay attention to what we eat, how much we exercise, our whole physicality. We pay attention to that. And then our fourth pillar is our pillar of environmental health. And often we don't think about our environment, but our environment is extremely important. The soil that our food grows in, it talks about our health. The air that we breathe impacts our health. What we drink, the water impacts our health. So many different things impact our health. And so we pay attention to those 4 pillars here on Talking with Dr. Donna. If you are not already a subscriber, I would really appreciate it. If you learn anything tonight, I just have 2 asks. If you have anything, you learn anything, you pick up anything, 2 asks as sort of payment for seeing the doctor. The first ask is that you subscribe to my channel. So if you're not already a subscriber, I would love for you to go over to my YouTube channel, hit the subscribe button, and then follow me. You can follow me on Instagram. You can follow me on Facebook. I'm available. So follow me. That's my first ask. My second ask is that you would share what you learned tonight. Share the message of what you learned tonight with someone, anyone in your circle, your family, your friends, coworkers. Share it so that you can really help to spread my message of better health. So tonight we're going to talk about diabetes, and we're going to talk about, more importantly, we're going to talk about the screening of diabetes, when you should get screened, who should get screened, why should you get screened. You might have seen a lot of commercials that are out there now about getting screened for diabetes, particularly type 1 diabetes. So we're going to talk about that tonight. So first, let me just give you some information about diabetes. And I think this is important. And again, like I said, normally I have slides for you, but tonight you're going to have to see it afterwards when I put the slide in. So tonight you're going to have to pay attention and use your visual and auditory skills to hear what I'm saying. Okay. So let's talk about why diabetes, why it's even a conversation. Why are we talking about diabetes? So there's 11% of the population, that's over 37 million people, adults, who have diabetes. And this is the part that I want you to listen and really pay attention to. When there's almost 37 million people who have diabetes, 1 out of every 5 people who have diabetes does not know that he or she is diabetic. And I want you to let that sink in for a minute, because that's important. That means that there are a lot of people who have diabetes and symptoms of diabetes that are not adequately treated. And that will then impact, as we talk about a little bit later, that's going to impact health long term as it relates to diabetes. So about 37 million people have diabetes. 1 out of every 5 people who have diabetes don't know that they have it. So there's an estimated of 1.5 million people who are diagnosed every year. Can you imagine, like 1.5 million people are diagnosed with diabetes every year? It's the 8th leading cause of death in the United States, but it's the number 1 cause of kidney failure, of amputations, and of lower limb amputations, and adult blindness. The number 1 cause of kidney disease, lower limb amputations, and adult blindness is diabetes. In the last 20 years, the number of adults who've been diagnosed with diabetes has doubled. Every year, more and more and more people are being diagnosed with diabetes. As I mentioned, 11% of the population have diabetes now, and that's been growing. If you look back when in 2004, when they kind of started paying attention to what it looks like, only about 1% of the population had diabetes. Now we're up to almost 11% of the population. It's a growing problem. It's an issue about why we have so many people who are being diagnosed with diabetes. So you might be saying, okay, there's a lot of folks. That's actually a lot of people that have diabetes. And so, well, what exactly is diabetes? Okay, so let's talk about a little bit background about what diabetes is. So diabetes is a disease that occurs when your blood glucose is out of control. So there's 2 types of diabetes. And each type of diabetes is caused by a different process of the disease. So there's type 1 diabetes and there's type 2 diabetes. So in type 1 diabetes, we're going to talk about that first. In type 1 diabetes, that type of diabetes is someone who cannot make insulin. And I know you've probably heard of insulin, and you're probably like, yeah, I've heard of insulin. What is it? Well, insulin is what helps to take the sugar, the glucose, you might see, or sugar in our bodies, which we all have. And every time you eat, you get sugar that's released. But really, you want that sugar to not just be out in your blood system. You want that sugar, you want to grab it up and you want to bring it into the cells, because your cells use sugar. That's how we get energy. That's how we are able to move and breathe and think, and all of the things. All of our organs use glucose. It's a really good energy molecule. Well, in type 1 diabetes, the pancreas, which is the organ that actually makes insulin, is unable to make insulin. And so because it's unable to make insulin, it's not able to take that glucose that's out of this, that's in the cells. It's not able to, or in the blood, sorry, it's not able to grab it and bring it in the cells so that your cells can actually use it for, what we need to use it for, all of the bodily functions that I mentioned. So type 1 diabetes has really the inability to produce insulin. And that's important as we kind of talk through this of why it's important to think about insulin. So that's type 1 diabetes. Now, type 2 diabetes is different, because type 2 diabetes doesn't have to do necessarily with the inability to make insulin. Your body usually can make the insulin, but what happens is that insulin that is there's either not enough or that it's ineffective. And so when there's sugar in the bloodstream, then it's unable to grab that sugar still and bring it into the cells. It's just a different reason why you're not being able to do it in type 1 versus type 2. Usually when we talk about type 1 diabetes, we're talking about, it happening in childhood. So we're talking about most of our type 1 diabetics are diagnosed in a child or as a young adult or as a teen. You can be diagnosed with type 1. And you don't really recognize, again, 1 out of every 5 folks who have diabetes don't know that they have diabetes. And so sometimes you don't really know until there's symptoms. And the symptoms for type 1 diabetes, and actually for both diabetes, is whether you may drink a lot, find yourself extremely thirsty. And no matter how much you drink, though, you don't really get your thirst satisfied. So that's 1. You might find yourself going to the bathroom a lot, or you're just like going to the bathroom, nothing there, but you're going and going and going. So it can be another sign of diabetes. The other sign could be that you're, again, just thirsty all of the time, even though you're drinking a lot. So those are some of the symptoms for type 1 diabetes. And we currently don't know how to prevent type 1 diabetes. They're doing lots of studies. There's lots of things out there. We know that it's considered almost an autoimmune disease, and that your body starts to create antibodies against your insulin cells, and then those kills off the insulin cells. So it's kind of an autoimmune disease for type 1 diabetes. So if you have a family history of people who have diabetes that was diagnosed as a child, more than likely that family member had type 1 diabetes. And yes, that means it increases your risk. If it's usually a first degree relative, it's going to increase your risk of developing type 1 diabetes also. In the United States, whites are actually more likely to develop type 1 diabetes than African Americans or Hispanic Latino. Doesn't mean that we don't get type 1 diabetes, but it just means that it's more common in white Americans, that it's an autoimmune disease. Type 2 diabetes, all right, so type 2 diabetes develops over time. And it develops as you get older. You can get type 2 diabetes, so it's not necessarily just because of bad eating, but it also can just be, again, hereditary. If you have a parent or a brother or a sister with type 2 diabetes, that increases your risk of diabetes. If you're not getting any movement in, right, that pillar of physical activity, not getting that in, that increases your risk. If when you're a woman and you were pregnant and you develop gestational diabetes, that's another type of diabetes that happens when you're pregnant. If you develop gestational diabetes, that's also a risk factor for you later on developing type 2 diabetes. Then, of course, we have our racial predilection, right? So African Americans, Hispanic, Latino tend to have higher rates of type 2 diabetes. Obviously, your weight, if I didn't say that already, increases your risk of type 2 diabetes. So multiple types of diabetes. Type 1 usually, and these are broad generalizations I'm giving because there's always exceptions in anything that you'd happen to do in medicine. But generally, type 1 diabetes, we're looking at an autoimmune process where your body, the organ that makes your insulin, the pancreas, doesn't make insulin. So you're unable to pull that in. And then type 2 diabetes generally develop as you get older in life. And that there's a number of risk factors that lead you to type 2 diabetes. All right. So we've talked about the different types of diabetes. And now let's talk about why it's important, why we even pay attention to it. We know it causes chronic kidney disease, We know it's the number one leading cause for amputations in the lower leg and the number one cause of adult blindness. I think I've shared with you all this story that my maternal grandmother, so my mom's mom, became blind from getting diabetes that was undiagnosed, that she did not know that she had. And she was on a train traveling from Louisiana to California. When she got on the, bus, I said train, got on the bus. When she got on the bus in Louisiana, she had her eyesight. By the time she got off the bus in California, she had gone blind. So it is, it's a long trip, but it is just that important to recognize the signs and symptoms of diabetes and to not ignore them, to get them checked out. And so when you have diabetes, that means you have a high level of sugar or glucose in your blood system. And your blood, as you know, travels to all parts of your bodies. So that sugar, super high, will travel to all parts of your body as well. And so it will go to your brain, right, and cause brain issues. It will go to your liver. It will go to the pancreas, your colon, your kidney. All of these areas can be impacted by diabetes. When we look at kidney disease, I told you it's the number one cause of kidney disease in the United States. It causes almost 40% of all folks who have kidney disease because of two things that we talk about on this show all of the time. Number one reason for kidney disease, diabetes. Number two, second cause of causing kidney problems, high blood pressure. We talk about those two things all of the time, and this is why, because it is complicated by diabetes. Diabetes can cause stroke. It can cause a heart attack. It causes the arteries in the lower body to really not function well. That's why you might find people that say, they have what's called peripheral artery disease. So that means the arteries that are in the lower parts of their body, or the periphery of your body, are not functioning as well. So it doesn't pump the blood back up to your heart, right? Your blood comes down from your heart down into your legs, and then your veins are supposed to push and pump that blood back up to your heart so it can come back and do what it needs to do. If you have peripheral artery disease, your arteries are not functioning. They're kind of loose and they don't really pump very well. So the blood doesn't return back up to your heart. It can cause damage to the nerves, the vessels in your eye, and that's what causes blindness. It can cause glaucoma. It can cause cataracts. So all sorts of different eye diseases develop from having diabetes. There's also foot complications. And if you know anybody who's diabetic, you know you don't want them to walk around barefoot, right? Because it also impacts the nerves, peripheral neuropathy, we call it. So the nerves in your periphery are not as sensitive. You can't tell if you stepped on something. You may not be able to tell if you're even cut or injured. And again, because of the poor blood flow, then the ability for that area to heal, right? So the blood carries all sorts of healing cells as well. And if you have diabetic neuropathy and you cut yourself or harm yourself in any way, then it's hard for that area to heal because your nerves are damaged, your vessels are damaged, and it doesn't lead to your body healing well. We know that we can cause ulcers, that's diabetic foot disease, and it can cause kidney disease. We just talked about that. So diabetic complications from diabetes there's a lot. There's a lot of different things that can go wrong. So what are we going to do? What are we going to do? What I want you to do is I want you to think about testing and screening. So there's a couple of new things that you may have seen on TV. I know I've seen the advertisement, which is sort of what prompted me to talk about screenings tonight. It's because I've seen the commercials where they say, when should you screen? There's a new screening test out that has been developed for diabetes. Well, it depends on the type of diabetes. So type 1 diabetes, remember, it's an autoimmune disease, right? So you can't screen for it in the same way that we screen for type 2. For type 1 diabetes, this new screening test looks for those antibodies that I talked about, right? The antibodies that tend to cause disease. It is going to screen for those antibodies. If you take this test and you don't see any antibodies, that means that you're probably not going to develop type 1 diabetes. If, however, there's a presence of one antibody, then that means that, then there's a likelihood that you're going to develop diabetes. If there's multiple antibodies that they see in the screening test, that means that there's an even higher risk of you developing type 1 diabetes. So why is it important to develop a test to find out if you have an autoimmune disease if there's really nothing that you can do about it? Well, that's the key. That's what they're attempting to do now. If you take this screening test for type 1 diabetes, there are some studies out there and some treatments out there that have been showing really good promise that if you find out that you are at risk for diabetes or that you have diabetes and you find it early, so these tests are probably detecting it before you may even have symptoms, right? So that drinking a lot and peeing a lot and being thirsty a lot, those symptoms that I talked about for type 1, you can maybe detect that before you even start to have symptoms. And what that can do is to allow you to start treatments earlier. And that can then delay the use of you needing to have other types of treatment, maybe by even 2 years. That's pretty good, right? Particularly considering if you're a kid, right, and you get this disease, we know that chronic diseases in kids do all sorts of things in terms of not just their body and their physical growth, but also their mental and emotional well-being. Imagine how difficult it is to have a chronic disease as an adult. But now here you are as a child, you're trying to still participate in sports. You've got insulin that you have to take. It can be really devastating to a child. So being able to develop and figure out if your child has diabetes before they have symptoms, and then to be able to move them into treatment that can probably delay the need for something like insulin for a couple of years is huge. That's a huge breakthrough and amazing. So if you have a child, it's worth you having a conversation with your pediatrician, your child's doctor. If you have a family history of type 1 diabetes, it's probably a worthwhile conversation to have with your doctor to say, hey, is this something we should consider? For type 2 diabetes, this is again onset happening older. That screening is called a hemoglobin A1C. And once you hit the age of 45, it is recommended that you get that screening test. That's a blood test. And what that does is it looks at your blood sugar level for the last 3 months. So it doesn't matter that you had a piece of cake before you went in. And so that can't be used as a reason why your hemoglobin A1C was elevated, because it's actually looking at what your body was doing 3 months ago. So doing it today, not so impactful. So it's really a good indicator of what your blood sugar levels have been over the last 3 months. And so it's a good indicator of disease. And it's a good indicator to say, all right, I need to make some changes. So sometimes you'll get that lab back and they'll say you're pre-diabetic. And so what that means is buckshot, warning sign that you got to make some changes. Because if you don't make some changes, you're going to probably move into developing type 2 diabetes. Those changes usually occur in your diet and usually occur in your movement or exercise. So you got to get some of that in order to help prevent type 2 diabetes. So screenings are important. Screenings for type 1 diabetes is being developed. Screenings for type 2 diabetes is already developed. If you're over the age of 45 and you have not yet had a hemoglobin A1C, I highly recommend you talk to your doctor and get that screening test done. Okay. In addition, start adding in some exercise if you're not already doing that, and try to stay away from foods that have added sugar. We talk about this a lot because we do food of the month every month. And we talk about why it's important to have a healthy diet, a plate that's colorful because it has so many different benefits to eating a variety of foods. So we've talked about how much sugar you want to have in your diet, you want to consume, and we really want you to really think about the sugar, not because sugar causes diabetes, right? Because we just talked about what causes diabetes, but we know that in the African American community, it's often called sugar diabetes. And the reason it's called sugar diabetes or the sugar is because sugar or carbohydrates or glucose is really what's floating around in your blood system that causes the disease. But it's not caused particularly by eating sugar. Eating lots of sugar increases your risk because it increases your weight. And it increases, if you're not exercising, then that weight turns into the risk for type 2 diabetes. Okay. So we want to have a balanced diet. We want to make sure that we're doing our screenings at 45, type 2 diabetes. If you have a child and you have a family history, a parent, a brother who has type 1 diabetes, really talk about whether or not this screening is right for you, for your child, for type 1 diabetes. All right. We do food of the month, right? So this month we're doing our food of the month, and our food of the month this month in celebration of, all things harvest and Thanksgiving are pumpkins. Pumpkins are extremely yummy. I love pumpkins. Like I said, I have this pumpkin Thai dish that I love. It's a pumpkin curry, and it is so good. But our food of the month this month is pumpkins, and it really is high in vitamins, high in antioxidants, and which helps to decrease inflammation in your body, decreases the risk of cancer in your body. All of these things are reasons why we want to make sure we have you eat some pumpkins this month. Now, I know the first thing you're probably thinking is pumpkin pie. No, don't do pumpkin pie. Try to do something else with your pumpkins this month. And if you do something that's cool and exciting and looks good and tastes good, please do post it on my page so we can really get some good, some good ideas of what else we can do for our pumpkins. So our food of the month for the month of November are pumpkins. All right, so that's my show tonight. Thank you so much for keeping your appointment and talking about diabetes, the importance of screening for diabetes, the importance of understanding the causes of diabetes and how that might impact you and your family. So once again, thank you for keeping your appointment with the doctor. You have an appointment every Thursday at 6:30 p.m. My asks, again, is for you to subscribe to my channel if you're not already a subscriber. If you are a subscriber, thank you. And then so you can do my second ask, which is to share this information, share what you learned tonight, amplify the message, make sure, let everyone know about Talking with Dr. Donna. Share it. Have your friends, family members subscribe to my channel. Thank you again for keeping your appointment. I will not see you next Thursday because that is Thanksgiving. We will be eating good food and celebrating and enjoying family. And I pray that you are celebrating and enjoying with your family as well. And we'll see you back in 2 weeks. Thanks again for watching, and until I see you soon, take really, really good care of yourself and take good care of your family. All right? All right. Till then, see you soon. With Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel, and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna.